Next up, something a little different. So we're going to do the Halloween candy arm raise challenge again. So how many of you have had a conversation in the last, let's say, year about Ozempic? Yeah, me too. So I think most of us. It's definitely buzzy. It's making news headlines. Friends and family, people are being prescribed it. There's some pretty groundbreaking drugs coming out. This is just one of many. This is one in the diabetes area, but I know, at least from my perspective, being in healthcare, I get asked about it, and I have zero expertise. I really haven't studied it other than reading a few articles, and so I've been giving very limited information, and it felt a little shorthanded in those conversations. So I thought we'd bring in experts today, actual clinical pharmacists, to talk about these new GLP drugs, and I'm really excited to hear what they have to say. So from Associates in Family Medicine, Village MD, we have... get to my next thing. Dr. Ellie Rone and Dr. Katelyn Currier. Would you guys come up and fill us in on these GLP drugs?
All right. So hi, everyone. Thanks so much for having us. Again, my name is Katelyn Currier, and this is Ellie Rone. We are two ambulatory care clinical pharmacists who work at Village Medical Family Medicine Clinics in Fort Collins. So our day-to-day kind of duties involve helping patients manage diabetes, blood pressure, cholesterol, but we also get a lot of consults on weight loss medications. So we really wanted to focus on those today and giving kind of a fast and dirty overview of these medications, kind of their effectiveness, and some clinical pearls that hopefully you guys can take away. So we came up with a nice catchy title called Where There's a Will, There's a Way, the Skinny on Wegovy and Saxenda. So neither myself nor Ellie have any financial or non-financial relationships to disclose at this time. So quick outline, we're going to try to cover a lot in sort of a very short period of time. We're first going to start by overviewing the family of medicines that Saxenda and Wegovy belong to. These medications family is called glucagon-like peptide 1 receptor agonists, which is quite a mouthful. So we'll be referring to them as GLP-1s. We'll be talking about the available medications as well as just how they work in general. We'll then jump into the medications specifically that are approved for weight loss, going into who they're indicated for, how they're given, general information on dosing and effectiveness, and safety. And then we'll finally finish up with some clinical pearls that hopefully will be helpful. So we'll be focusing on cost, shortages, which is very pertinent in today's day and age, as well as the influence of social media on use of these agents. And finally, we'll finish up with a summary and hopefully have some time at the end for clinical questions and general questions, because we know this is a very hot topic. So first, let's start with an overview of these medications or this medication family. I think it's really important to kind of talk about how these medications work. So these medications, some of them are approved for diabetes and some of them are approved for weight loss. And their mechanisms of action impact both blood sugars as well as weight. With regards to weight, these medications help to increase the feeling of fullness after eating. So people will typically eat less on these medications, which results in weight loss. Additionally, they slow how fast your stomach actually processes food, which again, with slower emptying of the stomach, typically folks feel fuller with a smaller amount of food, which results in weight loss. But they also have great impacts on blood sugars. Big mechanism of action here is they tell the body to release insulin after eating, which basically tells your body to pull blood sugars out of the blood and into cells to lower blood sugars. So they're great for helping with diabetes as well. It's really important here to emphasize that they are, again, have different indications for different medications. So we have certain medications that are approved for diabetes. As Jonah mentioned, Ozempic is one of the big ones, but Trulicity and Victoza are a couple of other ones that are commonly used. And then the two that we're focusing on today are the weight loss approved GLP-1s, so Saxenda and Wegovy. So let's jump into these medications in a little more detail. So who really are we using these medications for? So these medications are approved for certain patients who meet specific criteria. So they are both approved in addition to a calorie-reduced diet, as well as some sort of exercise or increased physical activity for chronic weight management. Additionally, they are approved for any adults with a BMI of 30 or greater, or those with a BMI of 27 or greater who have at least one kind of weight-related condition. So these are things like diabetes, high blood pressure, high cholesterol, and certain cardiac conditions. Interestingly, both of these medications can also be used for pediatric patients 12 years of age and older who meet certain kind of weight-related criteria. I also think it's important to kind of touch on how these medications are given. So they are both given via injection. Wegovy is one that is injected once weekly, whereas Saxenda is injected daily. They're given with very, very small needles. They're actually less than 1/5 of an inch in length. And they're given subcutaneously in either the belly, the outer thigh, or the back of the arm is typically the usual injection locations. So typically how they're dosed is they're started at a very low dose, and then after a certain period of time, the dose is periodically increased until the maximum dose or maintenance dose is reached, which is then continued long-term for the weight loss benefits. With Wegovy, that dose is increased every 4 weeks, and ultimately the max or maintenance dose can be reached in around 4 months, whereas for Saxenda, you can increase the dose more rapidly, and the dose can be increased every week, and a patient can actually get to that maintenance dose in about 1 month. And I also think it's important to touch on, do these medications actually work? So both of these medications did undergo extensive clinical trial testing. With regards to Wegovy, patients actually on the maintenance dose of 2.4 milligrams lost an average of 34 pounds over 17 months, which was actually 15% of total body weight, which is pretty significant. This translates to an average decrease in waist circumference of about 2.4 inches. Saxenda was also shown to be quite effective in clinical trials. The maintenance dose resulted in, on average, a 15-pound weight loss over 17 months. But when patients did adhere to the reduced calorie diet and increased physical activity, an even greater weight loss of up to 21 pounds over 1 year was noted. So I'll turn it over to Ellie to kind of finish up with these GLP-1 overview, as well as to kind of touch on the clinical pearls for these medications.
Yeah, hi, my name is Ellie. I'm another pharmacist that works with Katelyn. So the big piece with these that we talk a lot about when we're starting a patient on one of these for weight loss, or if we're starting, the diabetes version, is we always touch on the side effects. They are associated, the biggest ones that we see short-term are nausea and vomiting. And this really ties back to what Katelyn talked about of why we titrate that dose or go up on dose really, really slowly and over months to weeks, depending on which agent that we're using. So again, nausea and vomiting are the biggest ones that we see. And sometimes we need to go slower on our titration. And so that would look like extending, the interval of how long we go before we increase to the next dose. And so that's a big thing that Katelyn and I do for both weight loss and for our diabetes patients, is making sure that patients are tolerating it, but so that we can also get them to that maintenance dose, as Katelyn highlighted. Some other side effects are just injection site reaction. Again, these are all injectable medications, and so that's a very key one that we like to touch on. But a lot of that can be avoided with proper education and teaching patients how to use the medication appropriately and making sure they're giving it correctly. Also, just some other ones short term include diarrhea, constipation, or abdominal pain. Really focusing on kind of those GI side effects are very common, although a patient could also have no side effects. But again, we just like to make sure that they're aware that these things could happen while they're on these medications. And then also listed there are some other side effects associated with the medications. Now, I think the big thing to talk about, or we get a lot of questions about, is long term. So, will we keep the weight off, or will we maintain lower blood sugars if we stop the medication? And so I like to think of it as, there is some evidence for the different ones, that potentially 3 years out, you might have continued benefits from the medications. But ultimately, once you stop the medication, you lose both the positive and the negative side effects and benefits of the medication over time. Then just some other things, or some precautions and contraindications, which is just cases of when we wouldn't want to use these medications for different patients. So the big one and some criteria that we always work through is if a patient has a history of pancreatitis, we don't use these agents, whether that's for diabetes or for weight loss. Similarly, we don't use these in type 1 diabetes patients. This includes our type 1s. If we're trying to consider it for weight loss, we still wouldn't use these agents. And then the other thing that we look at is if a patient has a personal or familial history of thyroid cancer, we also would not use these agents. Some other just precautions to consider. The big one, if a patient has a history of gastroparesis, it is indicated that you could still use them. Typically, we do still try to avoid these agents in those patients. And then renal, so that's kidney function. So if a patient, that really depends on the specific agent that you're using, and we would take it by a case-by-case basis, depending on their current kidney function. And then the last two, just kind of precautions if a patient has diabetic retinopathy. Again, this is more so for our patients that we're considering these agents for in diabetes. And then in this past summer in June, the American Society of Anesthesiology put out some guidelines of what to do for patients that are on these agents for either weight loss or for diabetes, and what to do prior to a planned surgery. And they do recommend, that the patient stop it for at least a week before the planned surgery. And then just overall, these medications should not be used in women that are planning or are pregnant currently. And then I think the big thing, that we get a lot of questions from patients and even providers and, our own family members about is some of these clinical pearls, related to cost and just different things like that. So we'll spend a good amount of time here, and I encourage you guys to ask us questions about this too. We're happy to, kind of answer anything that you guys have, because there is a lot of information out there on the internet about these medications. So the big thing is cash, or cost, I should say. And so this is an area that Katelyn and I deal with a lot, is because right now a lot of the insurance companies are not covering these medications for weight loss, and sometimes even for diabetes. It really depends. And so this is a big, it really depends on the patient's insurance. And then otherwise we're turning to other resources. Some patients are, they really want to try the medication, and so they're up to paying the cash price. I have listed here what a month's supply of each of these would be about. It's ever changing and things like that. And there are, so for Wegovy specifically, there is a program out there to help kind of with some coverage issues. However, they are not currently taking any new patients into that program. So if you're already in the program, then you get to continue to use the saving benefits of it, but they're not open anymore to new patients. And Saxenda no longer has a program to help with coverage. So really, if a patient's insurance is not going to cover it, their only other option right now is to pay cash price. And then the other thing that we're dealing with these medications is just shortages. And so I'll talk a little bit about why this is and what this means for patients and what that looks like. So Wegovy, per their manufacturer, they're just kind of struggling to keep up with the demand of these agents. And they have, a statement on their website, and, they're trying to different things to increase production, but there is a significant amount of demand right now for that specific agent. And, they're just doing different things, increasing number of manufacturers, so number of people making the medication and things like that. But I know from Katelyn and I's personal experience, this is one of the hardest things. We'll go through a full education with a patient, we'll get them started on Wegovy, and they decide, ultimately they want to pay cash or their insurance does cover it, and then we can't get them on the medication, and it takes months for them actually to get the medication. So, it's kind of difficult because they get their hopes up and they're excited to start it, and then they can't actually get it. So, and then Saxenda, similar kind of thing. They don't have a statement out right now, but it's another difficult one for us to get for patients right now as well. The reason, or a big reason for the shortages, outside of supply and demand, is more so related to our diabetes medications, those agents that Katelyn talked about earlier on in the presentation, and that relates to medications not being used for their intended indication. And so, for example, that would be using Ozempic for a weight loss patient versus using the Wegovy version of it, and so that's leading to shortages of our diabetes agents, which is kind of creating just this cycle of shortages of all of the agents. And we can say as of recently, Ozempic was on shortage, and then it really wasn't through this summer and early fall, and then we're having issues getting it again for our patients with diabetes. So it's just kind of creating this cycle, unfortunately. And then just the overall influence of social media. I know a lot of the patients that come in to see us, they have a friend that's on an agent, they saw something on TikTok, or they saw something on Instagram, or whatever the reason would be. And so that's leading a lot to these medications being used off-label. So again, Ozempic or Trulicity or Victoza being used for weight loss rather than saving those for our diabetes patients and prioritizing using Wegovy and Saxenda for our weight loss only patients. And then just kind of to summarize everything Katelyn and I talked about here, really Wegovy and Saxenda are the two medications used or indicated for weight loss. The other agents are not FDA approved for weight loss, but that doesn't mean that they aren't being used off-label and still being used for weight loss. But again, that's kind of creating that shortage, so that our diabetes patients can't get the approved medications. And really they help with weight loss by, helping patients feel fuller faster and then slowing down how quickly the stomach is emptying. And then Wegovy is weekly and Saxenda is a daily injection. And GI upset, nausea, vomiting are the most common side effects associated with the medications. And then really cost and coverage is kind of a burden and difficult. But there is options out there, but unfortunately for right now, they are very expensive for cash price per month. So at that, I will open it up to questions if we have time, or Katelyn and I's emails are also on there. Yeah. Yeah, so for diabetes, really the coverage depends on the patient's specific insurances. Some of the insurances require a patient to be on other diabetes meds for a couple of months before they'll cover one of these, or, we run into it a lot too, where they just won't cover the medication. It's not on their formulary, they won't cover it, or they do cover it, but it has a really, they have a high deductible plan or something, so they have a really high cash price. But yeah, similar, I don't know exactly, but cash price for the diabetes versions are about the same, or somewhere up there near $1,000 a month. So
I would say, though, that the coverage for the diabetes indicated GLPs tends to be, in general, better covered. Like, there is usually at least a couple of them that are on a patient's preferred medication list with insurance, whereas it seems like across the board, regardless of insurance, Wegovy and Saxenda tend to not have as great of insurance coverage.
What other questions you guys have?
Okay, seeing none, thank you very much. Interesting? I know more, so that's helpful for me anyway. Just to put this in context, this is growing, these GLP-1 medications, it's $13 billion estimated for 2023. It's growing by just over $1 billion a year. And we've seen that escalate the last couple of years. They mentioned social media. Again, as I mentioned Ozempic specifically because that seems to be the one, for whatever reason, that got out there. It is a diabetes drug. It's not supposed to be used for weight loss, but the context of those conversations I'm having are all about weight loss, and it's very exciting to a lot of people who've struggled with obesity. So again, there are drugs that are approved. I think that's a big takeaway. And if you're a business owner, I do health insurance, that's my day job, and this is becoming a major concern to health plans. How are we going to cover this? do we cover it? If we do, can we afford to cover this? If we have, let's say, 20%, 30% of our population that's obese and they all want to take this at once, that becomes a huge cost when we're looking at $12,000 to $13,000 a year per person on a plan. So some things to be aware of, and we'll continue to track it. But anyway, great information. Thanks again.